Good morning and welcome to Team HISD. My name is Dawn Miles and I'm one of the benefit counselors here at HISD, and I'm going to go over the benefits that we offer here to help you with your enrollment. First and foremost, all of the information that will be presented is on our website, www.hisdbenefits.org. And our website is a public website, which means that you can visit it at any time. Also, if you have any questions, please email us at benefitsoffice@houstonISD.org. First, our medical plans are offered through Aetna, and our medical plans are cost-sharing plans. What that means is that you'll pay a portion of it for your part of it, and then HISD will also pay a portion of it. Some other important health insurance terms to know. Deductible. All of our plans are deductible plans, which means that you're going to pay upfront and out of pocket before you get into the co-insurance, which is the second term on the slide. Once you meet your deductible, you'll get into the co-insurance. The co-insurance will help you save. As it states, co-insurance, the insurance company will pay a portion of it and you'll pay a portion of it. That third term on the slide is out-of-pocket max. This is the most that you'll have to pay out of your own pocket before the plan will pay at 100%. Our third term, ACO, or Accountable Care Organization. We have two plans that are ACO plans. The important thing to take note about our ACO plans is that it is a group of doctors that's going to work together to coordinate your care. This will help you so that you're not having to repeat blood work, different tests, exams, and other important medical information, as the doctors within your ACO are going to share information. Also, please take note there is no out-of-network coverage. What that means is that if you select one of the ACO plans, you must get care within that selected ACO. One of the ACO plans that we have offered is the Kelsey Select ACO. The Kelsey Select ACO is available for our employees that make $29,120 or less. As the name suggests, this means that you would get all of your care, you and your covered dependents, from any one of the Kelsey locations. Now, if you've driven around the 16 loop at least once or twice, I'm pretty sure you've run into one of the Kelsey locations. They are throughout our neighborhood and throughout the Houston area. Again, the Kelsey Select is for employees that make $29,120 or less. If you've been around HISD for a little bit, this is what is referred to as the $5 per month plan, as it is only $2.50 per pay period for employee-only coverage. If you select this plan, you also receive free services at our HISD Health and Wellness Centers, as well as our participating Next Level Urgent Care Centers. And I'll talk about those two in a moment. Our other ACO networks, Kelsey and Memoria Hermann. With the Kelsey ACO, that means, again, you and your covered dependents are going to get all of your care from Kelsey. With the Kelsey ACO, you do not have to select a primary care physician and referrals are not needed. With the Memoria Hermann ACO, you and your covered dependents are only able to see doctors that are participating in the Memoria Hermann ACO. One of the questions that is most frequently asked as it relates to the ACO is, which hospital am I going to go to? In the event of an emergency, you're going to visit your nearest emergency room. Again, in the event of an emergency, you're going to visit your nearest emergency room. If it's a planned hospitalization, your doctor is going to let you know which hospital you're going to go to. So, for example, if I select the Memoria Hermann plan, and let's say I wake up, my throat is feeling a little sore, I call Memoria Hermann, and I say, I would like to see an ENT or ear, nose, and throat doctor. I go to the ENT, they say, we're going to take out your tonsils. The ENT is going to let me know which hospital I'm going to go to, when to show up, and all of that. Likewise with Kelsey, I don't need a referral. I go see my specialist. If it's something that requires a hospitalization, my specialist is going to let me know which hospital I'm going to go to. Our third network is the Texas Medical Neighborhood. This plan works a little bit more differently because it is a more open network. With the ACOs, you have to stay within your ACO. With the Texas Medical Neighborhood, you're going to have participating providers from Texas Children, Memoria Hermann, St. Luke's, Methodist, MD Anderson, and such forth. Again, there are no out-of-network benefits, which means that you should ensure that your doctor that you're seeing is participating within the network. If it's an emergency, you're going to go to your nearest emergency room. If it's a planned hospitalization, your doctor is going to let you know which hospital to go to. Once you decide which network you're going to be in, your next thing that you'll have to decide is if you're going to get basic or plus. Now, the difference between basic and plus is going to be your deductible. Basic is not going to give you less care, and plus is not going to give you more care. Again, the difference between a basic and a plus is going to be your deductible. Basic is not giving you less care, and plus is not giving you more. Remember, all of our plans come with a deductible. No matter which plan you choose, you're going to have a deductible. The basic plan option gives you a higher deductible but a lower per pay period cost. And the plus plan is the opposite, where you have a higher per pay period cost and a lower deductible. For example, if you need to meet your deductible sooner so you can get into the co-insurance, you might select the plus option. But maybe you don't need to meet your deductible and you don't need to get into the co-insurance, you can select the basic. The basic and plus is available on each of the plan options, Kelsey, Memoria, Hermann, as well as Texas Medical Neighborhood. It is important that you ensure that the doctors, providers, and specialists that you and your covered dependents are seeing or will be seeing is in network. This is our on-site representative, Ms. Johnson. Ms. Johnson can assist you in ensuring that the doctors, providers, specialists that you are seeing or want to see are in network. Remember, there are no out-of-network benefits, and once your plan begins, you will not be able to make changes to your plan. So you can reach out to Ms. Johnson and ask her, hey, is this doctor in this network, or can you give me a list of providers in this zip code and let me know which network they're in? Again, please check and make sure that your doctors are in the network that you're selecting. Once you select your network, your plan, and the plan begins, you will not be able to make any changes. This slide goes over our 2022 medical plan rates at each coverage level. You can cover yourself only, employee plus children, employee plus spouse, or you can cover the whole family. We also can see the difference between a basic and a plus. Remember, the basic is the plan option that has that higher deductible and a lower per pay period cost. And the plus is the plan option that has that higher per pay period cost with a lower deductible. Next is our prescription drug plan. Once you enroll in a medical plan, you are automatically enrolled in prescription drug plan. Our prescription drug plan is offered through Express Scripts. So once your plan begins, you'll receive a medical ID card from Aetna and then also a prescription ID card from Express Scripts. Express Scripts is accepted at a wide range of pharmacies, including Kroger, Walmart, HEB, as well as Kelsey Pharmacy. One of the unique things about our Express Scripts pharmacy prescription coverage is that you can order your prescriptions by mail, as well as the Smart 90 program. With the Smart 90 program, if you take medications for high blood pressure, high cholesterol, and or diabetes, you can get those medications for free. Again, with the Smart 90 program, if you take medications for high blood pressure, high cholesterol, and or diabetes, if you're able to get a generic prescription on a 90-day supply, you can get those for free. With the Smart 90 program, you can go everywhere except for CVS, Walgreens, and Target. Next, we're going to go into our voluntary plans, and we're going to start with the dental plan. Our dental plan is offered through Cigna, and Cigna has 3 options for our dental plan. We have a dental HMO, a dental PPO, and a dental PPO buyout. With the dental HMO, you have to select a primary care dentist. The primary care dentist will make referrals as necessary, and it comes with a set fee schedule. What the set fee schedule means is that once you go to the dentist, you see your primary care dentist, you get your treatment plan. That treatment plan is going to have codes, it's going to have the names of the services and what you are to pay. But your set fee of services sets in a certain fees of what you'll pay for your treatment. The dental PPO plan works a little bit differently. The dental PPO plan gives you options. You can see any dentist, but you'll save more money when you're seeing a dentist within the Cigna network. The dental PPO does not have a set fee of services. It has a $50 annual deductible, and it comes with an annual max. That annual max starts at $1,350. What that means is that if you reach $1,350 within a calendar year, the insurance company will not pay out for that calendar year. But you can raise that annual max each year by getting your exams and cleanings. The dental PPO buy-up plan works similar to the PPO plan. It does not have that $50 annual deductible for preventive services, and your annual max starts at $2,000. Again, our dental plans are offered through Cigna, and here is our Cigna Dental OnSite, Mr. Edward Garza. You can reach out to Mr. Garza if you want more information on a set fee of services for the HMO plan, or if you want to check to see if the dentist you're seeing is in network, and to get more information about the PPO plan as well as the PPO buy-up. Continuing, we also offer our vision plan. Our vision plan is offered through iMed. iMed has two options, a basic and a plus. The difference between basic and plus is when you're going to get your frames. Basic allows you to get frames every other year, where the plus plan allows you to get frames each year. Besides that, it's going to work the same. You're going to pay $10 for your exam. It offers in and out of network benefits. Your exam covers both glasses and or contacts, and the retinal imaging is limited up to $39. Again, our vision plan is through iMed. And iMed is accepted at a wide range of locations. You can visit www.imed.com for a list of locations, as well as when your plan begins, download the iMed app or create an account to get information about your specific plan and the additional discounts that are offered through iMed. Our flexible spending account. We offer an FSA or flexible spending account. One of the important things to highlight about the healthcare flexible spending account is that it is IRS regulated. So that means Uncle Sam sets the limits, the boundaries, everything about this plan. The limit for 2022 is $2,750. How it works. With the Healthcare FSA, this is where you can set aside monies pre-tax for your medical, dental, vision expenses. Your contributions are taken out of your paycheck from when your benefits begin to the end of the year. And our benefits run a calendar year no matter when your benefits begin. So if your benefits are beginning in April, they will run from April to December, and then a new set of benefits will start in January. With the Healthcare Flexible Spending Account, you will receive a PayFlex debit card with the full amount on it when your benefits begin. And you can use that for your medical, dental, and vision expenses for yourself and your dependents. One of the things that employees complain about or have concern about the most about the PayFlex Healthcare Flexible Spending Account is that there are times that PayFlex will require you to verify your purchases. If it's something that's dealing with your medical, you can reach out to our Aetna representative for the EOB or your explanation of benefits. For dental, you can reach out to Edward for your EOB explanation of benefits, a bill or billing summary for dental visits. The Dependent Daycare FSA. As the name suggests, the Dependent Daycare FSA is for your dependents' daycare needs only. Again, the Dependent Daycare FSA is for your dependents' daycare needs only. If you have a dependent that is 13 and under, you and your spouse may set aside up to $5,000 pre-tax per year for your dependents' daycare needs. Unlike the Healthcare FSA, this cannot be used for your dependents' medical, dental, vision needs, and the Dependent Daycare FSA is a reimbursement. So how it works, you select the money, you select the amount that you would like for the calendar year. It's going to be divided by the paychecks, the remaining paychecks you have from when your benefits begin to the end of the year, and you can use those monies as it is payroll deducted. Again, the dependent daycare is for your dependent daycare needs that are 13 and under. All HISD employees that are benefits eligible are automatically enrolled into a $10,000 basic term life insurance policy. If you would like supplemental coverage, you can select supplemental coverage up to 8 times your annual salary. If you select supplemental coverage, you can also add your spouse and cover your spouse up to 3 times your annual salary, and also cover your dependent children that are under the age of 26. Again, we also offer supplemental life insurance. You can cover yourself up to 8 times your annual salary, your spouse up to 3 times your annual salary, and your dependent children that are under the age of 26. If you select more than one time your annual salary, you may be required to submit EOI, or evidence of insurability. What this is that Securian, which is the life insurance vendor, will send you a notice to your HISD email address and ask you to fill out a questionnaire. You submit it back to them. And again, if you're selecting over one time your annual salary, you fill it out, submit it back to Securian. Our next plan that we offer is a disability plan. Now, with our disability plan, it's a long-term disability plan. As a benefit, we do not offer short-term disability. With a long-term disability, you select your waiting period and a percentage of your pay you would like. The disability plan also comes with a pre-existing clause condition. What this means is that if I have my disability before the plan begins, it will not pay out for that disability. So let's say my benefits begin April 1st and I give birth in June. It will not pay for that pregnancy because I was pregnant before the plan began. But let's say later on down the line, something happens, that requires me to be off of work. I submit my claim forms, Unum approves it, it will pay for that disability. The last benefit on this slide is one of our first AFLAC plans, the Cancer and Specified Disease Plan. Now, we offer 4 AFLAC plans. Now, with our AFLAC plans, they're going to work just like the commercials say. It is supplemental coverage where you receive a check directly and you do what you like with that check. We have a cancer plan, we have an accident plan, hospital indemnity, and critical illness. With the critical illness, as of October 2021, it now covers COVID. The accident plan is a 24/7 accident plan that will cover you on the job, off the job. And a hospital indemnity plan is one where you will receive a cash benefit for your hospital admission and stays for over 24 hours. And our plans work together. So let's say I have an accident and I break a foot, a leg, or something like that, and it requires hospitalization for 2 or 3 days. I fill out my claim forms for the accident, I receive a check for that. I fill out my claim forms for the hospitalization, I receive a check for that. HISD also offers a prepaid personal legal plan. Now, our prepaid personal legal plan is the only plan where you can cover your parents for an additional $3 more. Again, our personal prepaid legal plan is the only plan where you can cover your parents for an additional $3 more per pay period. With the personal prepaid legal plan, you can use this for wills, divorce, adoptions, small claims assistance, driving record restoration, and much more. Now, my favorite part of the presentation, the part where we discuss our free and valuable tools and resources, because I like things that are free and valuable. One of which is our HISD Health and Wellness Centers. You and your covered dependents ages 5 and up, once your plan begins, can visit one of our 2 HISD Health and Wellness Centers for absolutely free. They will see you for things such as colds, flu, immunizations, blood work, medication refills, just about everything except for workers' comp injuries. Remember, all of our plans come with a deductible no matter which plan you choose. That means that you're paying upfront and out of pocket until you meet your deductible. Our HISD Health and Wellness Centers, if you're enrolled in a medical plan, is a way for you to save money. Again, it is one of our free and valuable tools and resources. We have 2 locations. One is here at Hattie Mae White. The other one is at Addicts Middle School. Additionally, they are operated by Next Level Urgent Care Centers. You and your covered dependents can visit one of the participating Next Level Urgent Care Centers for $20. The list of participating Next Level Urgent Care Centers is on our website. Again, please visit our website to get the list of participating next level urgent care centers. They are throughout our Houston area, but not all are participating at this time. Again, you and your covered dependents can visit for $20. And that's $20 for whatever they can do there at that center. I've gone and I've had x-rays done for my daughter, and all I paid was $20. The times that I've been in and out within an hour. I've downloaded the app, I make my appointment, or I get in line via the app. I go, let them know I'm an HISD employee, pay my $20. I see the doctor, good service, and again, I'm usually in and out within an hour. Additional free and valuable tools and resources include our EAP, or our Employee Assistance Program. Now, when you think about EAP, most people think about counseling. And ours is unique in that it does offer the counseling service. It's 24/7, it's confidential. HISD does not get a report of who's calling, what, when, how, or why. Ours offer 8 free sessions with a professional counselor per person per year. Again, that's 8 free sessions with a professional counselor per person per year. And that's for each member of your household. So maybe you have a son or a daughter that's getting ready to graduate high school, getting ready to graduate college, or just a school-age child that needs to debrief after everything that's happening. They can get their 8 free sessions. You may need 8 free sessions for yourself or for your spouse. Again, that's 8 free sessions per person, per issue, per year. Our EAP program also offers guidance resources, on-demand trainings, and webinars. I've used the EAP program for travel resources. I've called them up, said, hey, this is where I'm going. This is when I'm going. They put me together a travel package, and I was able to use that to get discounts and get great information and resources. Another free and valuable tool and resources is the Aetna 24/7 Nurse Line. With the Aetna 24/7 Nurse Line, you're able to call and speak with a professional nurse and get free medical advice. I've used it to call for my daughter who wasn't feeling good, and I was giving her the medications. They let me know, hey, since you've been doing this, just go ahead on and make an appointment. Called up Addicts Middle School, made an appointment. She saw a doctor. So to get her the care that she needed and to reassure myself that she was okay, I paid absolutely nothing. And I was speaking to a professional nurse, and I was able to get in and see a professional doctor. Absolutely free. Now you want to know, how do I enroll? When it's time for you to enroll, you will receive an email to your HISD email address. This email will come about 2 weeks after your hire date. Again, it's going to come to your HISD email address. And it will let you know, hey, it's time for you to enroll in benefits. This is when you can enroll. This is how you can enroll. And this is your deadline. You'll receive your initial invitation as well as email reminders. One of the ways you can enroll is through our HISD benefits website, or you can call and you can speak with a representative. Either way that you enroll, you're able to put together your benefits package. Our benefits are in active enrollment, which means that you have to actively go in and select the benefits that you want. That means that you can put together the benefits package how you want it. If you just want medical, you can just select medical. If you want dental only, you can select dental only. If you want nothing, you can select nothing. Some things to remember. You must enroll in your benefits before your benefits effective date. Your benefits effective date is the first of the month following 30 days of employment. For example, if your hire date is August 9th, 2022, your benefits effective date is October the 1st, 2022, which means that you must enroll by September the 30th, 2022. Again, your benefits are effective the first of the month following 30 days of employment. Beneficiary. If you're not selecting any benefits, we ask that you please go in and select and or update your beneficiary. Again, even if you're not selecting any benefits, you're waiving all of your benefits, we ask that you go in and you select and or update your beneficiary. This is your beneficiary for your HISD basic term policy or the supplemental life insurance that you might select during your benefit selection. Again, we ask that you select the beneficiary for your basic term and any additional supplemental coverage that you may have. You can make changes to your beneficiary at any time. And this is different from your TRS, or your teacher's retirement beneficiary information. With TRS, they send you a paper form, you send it back to them. More important things to remember: dependent verification. If you are adding a dependent and you're covering them for their medical, dental, and vision, you must provide dependent verification. So if you're adding a child that's under the age of 26, a spouse, a stepchild, adopted child, you're going to have to provide legal documentation. So that's that birth certificate, those are court documentations that says that you have legal custody of that child, as well as marriage license and marriage certificates with the stamp and the seal. You will select your benefits, confirm and submit your benefits. Once you confirm and submit your benefits, you'll receive information about dependent verification. You'll start receiving letters to your HISD email address, as well as your home address, saying, hey, we need this information. This is how you can submit it. This is the deadline. This is where you can submit it. Again, with dependent verification, you will receive letters to your home address, as well as your HISD email, that will state what is needed, how to submit it, and the deadline. It is important that you submit it by the deadline. If it is not submitted by the deadline, your dependent will be removed from coverage, and you will not be able to add that dependent again until the next enrollment period, which will be annual enrollment. That is all that we have here for the benefits department. Please stay connected with us. We're on Facebook, Twitter, and Instagram. Again, our website, www.hisdbenefits.org, is a public website, so visit it at any time. If you have any questions, please email us at benefitsoffice@houstonISD.org. Thank you.